serious doctors of Reddit. Who are you dumbest patients? Story 1. I worked at the ER during my internship and met a girl who had increasingly painful and red eyes since a couple days back. The last 24H have been horrible. I asked about all the normal stuff, and she claimed to have no idea why she had this eye problem. She had never had anything wrong with her eyes. I proceed to drop some dye in her eyes to check them in a microscope. And when I do, I realize she's wearing contacts. She didn't like her natural eye color, so she had bought a set of blue-colored lenses 8 months earlier, never removed them, not even during nighttime. Didn't even think to mention this to me. Claimed to have no foreign materials in her eyes. Needless to say, I gave her quite the harsh lecture and a referral to an ophthalmologist. Story 2. There was one who was very upset to find out that she was pregnant again because Shed used her diaphragm exactly as Shed been told. She carefully inspected it for holes, applied the spermicide, placed it, wore it at night, then took it out, cleaned it, and put it away each morning, and then her husband arrived home from his night shift. Story 3. I posted this a while back when a similar question was asked GP here. The most outrageous thing I've heard was from a boy who was something like 22 years old, very poor, illiterate family. The boy had a bad case of tonsillitis and refused to take any meds because all he needed to do was bite the sun. Basically, at noon, he had to look up to the sun, open his mouth as wide as possible, and bite the sun several times so it would burn his tonsils and cure him over the course of a couple weeks. When that wouldn't work, plan B was to do the same at night, but only under a full moon. TLDR, bite the sun and cure you tonsillitis. Story 4 had a patient who was convinced that drinking grape juice with baking soda was helping him fight prostate cancer. But your cancer is actually getting worse. I'm going to stick with my plan. I really feel like it's helping. Edit yes. It is kind of like Steve Jobs. You can all stop replying that now because we all get it. Story 5. I was an intern in the ER. I've seen a lot of stupid people. It was a small town and all. The worst, I think, was when I walked in and the floor smelled like, I don't even know, it was by far the worst thing I had ever smelled. I asked a passing nurse what the smell was, and he just shrugged his shoulders and told me someone probably everywhere. Well, the doctor is preparing to go into this room, but I did not expect what would happen next. He opened the door, and I almost barfed. It was extremely hard to keep my professional composure. The guy had his leg wrapped up. The doctor asked him to unwrap it, and it was gangrene from his foot up to the middle of his thigh. The smell I had been smelling was rotting flesh that caused the four-wheeler I was riding caught fire 6 months ago. Story 6, probably the diabetics who get admitted and then get put on a diabetic diet, but eat FC Pizza Hut that their families bring. Usually I hate the family and the patient. This was the one reason why I hated internal medicine. Story 7, surgical resident here. One that comes to mind while I was on the cardiothoracic service was a gentleman that came in through the trauma bay with a stab wound to the chest. He reported after we fixed a rather large hole in his right ventricle that he was just visiting a friend, and while on the stoop of the building, a random stanger stabbed him with a sword from a first-floor window. He proceeds to laugh, get back in his car with his buddies, and drive home, despite the rather profuse bleeding from his chest. He drives home for some period of time, and then eventually decides he should go to the hospital. Drives by himself to the hospital. Last thing he remembers was being on the way to the hospital. Lucky was found in the parking lot. Had passed out in his car. Eventually made it to the OR and walked away just fine. TLDR gets stabbed in the heart. Decides to go home and hang out for a while. Eventually, somehow drives himself to hospital before dying and without killing someone else on the road. Story 8, I am an ER doc. I once had a 20-year-old and his girlfriend come in at 2 a.m. freaking out because something had tore his throat open. He seemed fine, no blood, breathing fine. I had him open his mouth, saw nothing, so didn't want him to lose confidence in me. Clearly something had happened, so I'm looking and looking. There's nothing wrong with this kid's throat. Finally, I say, look, it seems okay. What do you feel or see? I don't feel it, but look, ITS right there. We're looking, it was his uvula. Somehow this kid had gotten to the age of 20 without ever noticing his uvula. Girlfriend was also horrified. I told them it was normal, did not believe me. So I told them I was about to blow their minds and showed him his girlfriend's uvula. Mind's blown, another life saved in the ER. Story 9, I work as a scribe in the ER. And we had a guy come and asking to be tested because he may have an STD. So we start asking him if he has had unprotected and multiple partners, to which he answers yes. Next we ask if he has any itching, rash, discharge, etc., to which he answers no. Well, this guy thought he caught asthma from having with some chick who had it. Asthma. He thought it was an STD. Story 10 had an old coot best possible description of the man who was sweet, but had clearly spent his adult years drinking away whatever brain cells he started with. He presented with a chief complaint of I can't drink beer anymore. Every time I drink one, I just throw it back up a few minutes later. Well, turns out hadn't been able to eat actual food in months, was subsisting on pretty much just beer, and hadn't in over 2 weeks, but that didn't bother him a bit until he couldn't have the beer. Then it was an emergency. He had a big OL tumor blocking the distal part of his left colon. So near the end of the road, intestinally speaking, and everything gradually got backed up all the way to his stomach. That's why he couldn't keep a beer down. There was just no more room at the inn. I fixed him with a colostomy, and he got better and left. He refused chemo, and I figured he'd just go home and die of cancer. But then, almost exactly 1 year later, he came back to me with just about the same complaint, obstructed to the point of not being able to drink beer, except this time, it was that his ostomy had essentially retracted in his abdomen, and the skin had nearly grown shut over it. He was shitting out of a teeny tiny hole in his skin. WTF. Even my oldest partners had never seen anything like it, but once again wasn't remotely phased. He just wanted us to fix it so he could go home and keep drinking. Haven't seen since. I kind of hope he's still out there, treating his cancer with Budweiser and just blissfully ignoring the Grim Reaper. We had a patient come in for theater. When asked if she had followed the fasting instructions, she said yes, but luckily the nurse didn't believe her. With some prodding, the patient eventually confessed to having 6 chocolate bars and an orange juice for breakfast. Obviously, the surgery was delayed. Story 11, we had a patient once on a PCA, a kind of pain medicine pump, with a button that the patient pushes to dispense more medicine. She thought she had to physically lick the button in order to get the medicine. It was weird. Story 12, I had a patient in her 30s complain of monthly rectal bleeding that would last 4 to 6 days and stop on its own. It started when she was 11. She just thought she should get checked out. It did stop for a while when she was pregnant. Story 13, during a fellowship in oncology, I had a nurse call me downstairs to discuss a patient. He was on a phase 1 clinical trial, and we needed to check trough values to see what his dose limit would be. We started out at 10 milligrams, in the form of 2 5 milligrams X4 tablets, so his dose could be modified without redispensing. Well, he could not comprehend the amount of pills he needed to take, just did not understand that he needed to take only 4 every day, and he had a month's supply. We had to physically withhold his medication and have him come to the infusion center every day to take his medication because he would have otherwise overdosed and died. How hard is it to understand you take 4 tablets a day? Story 14, there was the guy whose elderly mother suffered a massive brain hemorrhage, and I had to tell him there was nothing surgically we could do for her. He tearfully told me that he would do anything for his mama, and she could have his brain to save her life. Dude wanted us to do a brain transplant. I had to tell him that no. Unfortunately, that would not be possible. Story 15, optometrist here. Had a guy come in for a glasses exam for the first time in 10 years, and I discovered he had full-blown glaucoma going on, and I asked him if I could run a test to help confirm. He got super angry with me and demanded his prescription. I said, "I'll give that to you, but I need to prescribe you medicine to help save your sight." His response was, "Well, if the good Lord wants me to lose my sight, then who am I to stop him?" I made him sign a waiver, and he left. I've never been so frustrated at a patient. I hope he doesn't kill someone on the road one day. Story 16, this guy takes the cake by leaving dozens of needle tips in his neck. My best guess is that he was reusing needles by heat sterilizing the needles a little too well, causing the needles to lose their temper, become brittle, and break off. Story 17, there are several close calls. The patient who fixed an appointment for a pedicure the day after open heart surgery, he said that he'd just sneak out of the ICU and that nobody would notice. The patient who had an amputation of half of his foot and decided that it would be a good idea to walk to the toilet after returning to his room, covering the floor in footsteps because the suture ripped open again. The patient who said that he didn't have any previous operations, but was basically covered in scars. When asked about each of them, he suddenly remembered having about 15 surgeries for various accidents. The patient who forgot that he had his kidney, spleen, and part of the colon removed because of a tumor. The patient who decided that he'd never take more than 3 pills a day, because obviously taking more than 3 pills a day is going to kill you. He was on 4 or 5 different meds at that time, and basically just chose at random which meds he was going to take which day. Story 18, maybe not the dumbest patient I've ever treated, but certainly a memorable one. While working a night shift in the ED, I grabbed a chart for a PB, our shorthand for pregnant and bleeding. I walked into the room and came across a young woman who was laying on the stretcher with her legs open in a pool of blood and tissue. She was about 20 weeks pregnant and had been bleeding for almost 3 days before she decided that it was time to go to the hospital. When I asked why she didn't come in sooner, she replied that she thought it was just her period, since she had heard that you can still be pregnant even if you get your period. For medical clarity, yes, having a menstrual cycle shortly after unprotected does not mean you're in the clear and definitely not pregnant. Once you have a confirmed bun in the oven, it don't work that way. After having to explain to the poor daft girl that she was indeed pregnant, I then had to spend the next 10 minutes pulling from her vaginal canal the remaining products of conception from her miscarriage. Story 19. I still remember a guy coming to the hospital with his girlfriend and asking for the morning after pill. I asked them when did the intercourse happen, and he says, well, I wouldn't call it exactly intercourse, but my girlfriend would feel much more relaxed if she took the pill. Could you define the nature of your contact? What? My girlfriend is virgin, so we don't have, but last night we were in our underwear, and we were cuddling, and I kind of came a bit in my underwear. And then we kept cuddling, and my wet underwear was touching with her thigh. So maybe some found its way to the vagina. Story 20, not a doctor, but as an Army medic, I have had some dumb patients. One of the first guys I treated got really bad road rash from a motorcycle crash and decided to treat it himself by pouring whiskey on it. By the time he came to the medics, it was pretty bad, and I had to do debridement with a scrub brush, basically scrubbing the bad parts off with plastic bristles. He was in a lot of pain, and I was trying not to laugh at him. A lot of people don't respect medics at all, even when we were very good at our jobs. One guy came in with fluid-filled bumps on a red base around his mouth, textbook herpes. I asked him if it was his first herpes outbreak, and he started yelling at me for saying he had herpes. He refused to listen to anything else I said and asked for the PA, who took one look at him and asked if it was his first herpes outbreak. We once had a guy who had the tip of his finger amputated. His first question was, will this grow back? One guy had a sore back, and while I was doing the physical exam, he said, Doc, my spine is curved. It wasn't. That's why my nose is crooked. Medics all have lots of fun stories. Story 21, we had a woman that went through 3 hospitalizations for diabetic ketoacidosis in 6 weeks. Her glucose was up to 1100. Her explanation is that she didn't like her endocrinologist, so she refused to go back. Story 22 had a Marine once who came to me complaining of a rash to his right forearm, C2 weeks. This was his first visit for the issue and hadn't had anything like this before and was worried, since he reported worsening symptoms since initial onset. When asking about prior skin issues, he told me he had ringworm just prior to this rash. Look at his arm. It looked like a mild second-degree chemical burn in a rather circular shape, with blisters on the edges. What got me was the exact definition in the burn edge. Asking the young LCPL how he got that, he replied, well, that's the burn I got from the bleach I poured on my arm. When I asking him why he poured bleach on his arm, well, how else was I going to kill the ringworm? Story 23, I have the grandma, the mom, and the teen in the room. The teen is pregnant, but this apparently is a good thing. There are no fathers, grandfathers, boyfriends, jobs in the picture, but everyone decided it was about time a new generation was added to the family lineage. Apparently the teen did not appreciate the fatigue, full bladder, back pain, etc. that go along with being pregnant, and is also experiencing some cramping pains. She demands that we do a C-section because she's tired of being pregnant, even though she's still not far enough along, because then we could just hook up the preemie in an incubator to finish growing, and the government can just pay for the incredibly expensive ICU stay. My jaw just dropped. Then there was the lady wearing short shorts and no underwear who raised her leg and showed me the filled wound on her. While in the middle of the waiting room, I don't miss rural OBGYN experiences. Story 24 also. What about hypochondriacs? Have you seen patients who get all pissed off because you did not tell them what they wanted to hear? I'm just reminded of a friend's wife. I would hate to have her as a patient. Story 25, our leg necrotic with maggots. Has been this way for 30 days, wrapped t-shirts around the leg. And when the outer layer was soaked with pus, they threw another one on top. He finally called 911 for shortness of breath. He died from septic shock. My breath smells like trichomonas point, gets told she required urgent surgery after shoddy home birth. Give her instructions including nothing to eat. Walking to bring her to the and she's scarfing down Burger King. Tries to hide it after she sees me. Point is informed to begin taking a Eliquis, immediately anticoagulant. They just got a cardiac stent placed and told the risks of delaying taking that medication. The pharmacy was out of it for the weekend. She comes in 3 days later with the same chest pain as before. I thought you fixed me. Is my doctor stupid, am I? Story 26, dentist here. I had a patient a few years ago who could not understand how she had gum disease on her upper teeth. She, though gravity, would pull all the bacteria down on her lower teeth, leaving her top teeth plaque-free. Story 27, turns out using cement as a DIY cast for your broken but not reset leg is a bad idea. Turns out the chemicals in the cement irritate and dissolve your skin. He became septic and almost died by the time he presented for medical care, emergency medicine, preventing natural selection, one stupid person at a time. Story 28, I had a patient who came to the emergency department vomiting so much I had to admit him for intravenous fluids. I took the usual history, including what he'd eaten recently. Nothing out of the ordinary. A few hours later, he calls me over, Doctor, I did eat some chicken and rice earlier. My girlfriend made it yesterday, and we left in the pan on top of the stove overnight, and I ate it this afternoon. This was in a July heat wave. Do you think that could have been it? Yes, I do. Size, we had a little talk about food hygiene. Story 29, as a med student myself, and another student took a history from a guy who drank several 10 cups of tea a day with 6 sugars in each one for my thirst, and had 6 meals a day of 4 bacon sandwiches with butter for the energy. That's all he had every day. That's it. He couldn't understand why his heart disease wasn't getting better, why he had put on weight, why he was now showing high blood sugar, and was borderline diabetic. Get it seriously, guys. To the people telling me, but bacon isn't bad food, or whatever, I never said it was. Read what I posted, especially the bit where I said that's all he had every day. That's it. Because if you can't process that with the rest of what I've said, I think you're in danger of becoming a patient mentioned in threads like this. Story 30, they put a ring on for a week solid. Turned up with a penis like a aubergine color and swelling. No way it could be salvaged, given a full penectomy, as bad as it sounds. Now has a hole between his legs. At least that's the one that sticks in my mind. Edit makeshift cock ring. Story 31, ER scribe. One time this guy came in with a radish and a mouse shoved up his. He was summarily taken into surgery after everybody had a good laugh at him. Story 32, patient in a delirious state attempted to pull his Foley catheter, the kinds that swell up at the end to stay inside the body, out of his body. Forcefully, needless to say, he was blood for a while from all the damage to his internals. Edit forgot to point out he was in a delirious state from not taking his blood sugar medication. That's what makes it dumb. Story 33, when I was doing rounds in the ER for my medic, I encountered this woman. She was in her early 40s and was apparently a frequent flyer for pain meds. Since she had become known in the community, this was a small city in West Michigan, she was no longer able to trick doctors into giving her meds. So what does she do? She pulls out her own teeth. She had tried to do a couple, but they wouldn't come all the way out. She did eventually get one out, bit. This was after a few attempts. This isn't the stupid part, however. She felt that this may not do the trick. So she waited for a few days, knowing she would get an infection, and we would have no choice but to give her what she wanted. Well, it didn't work. They gave her NSAIDs and antibiotics. Story 34. While reviewing a new patient's medical history, this 30-some-year-old lady tells me that she has the worst pseudo-seizures her neurologist has ever seen. For the medical professionals, that sentence says so much. Story 35. I had a girl come to the ER for vaginal spotting and abdominal cramping. She had just started her first relationship and had taken Plan B every day for 5 days because she was worried about getting pregnant. They used condoms, and she was already on the birth control. Story 36. Had a girl in the ER who got beer poured over her while at party. She went to the bathroom to clean herself, but didn't find anything to wash herself with, like a sponge or something. So she used the next best thing she found and meticulously scrubbed her with steel wool. Story 37. Girl came to the ER for nausea vomiting. Tried to give her some Zofran. No thanks, I'm not really a medicine type person. My body rejects chemicals. Story 38. I assume you're not including those who are mentally retarded. So guy comes in with lumbar compression fractures after being pushed off a second-story balcony by his girl. He's told by more than one person to leave her, including doctors and cops. He doesn't press charges. Comes in a year later stabbed in the back with a kitchen knife that went all the way through his chest and was sticking out the other side. Who was he stabbed by? The same girl. He lived, was lucky the knife missed his vital organs. Another one. Guy brought in after trying to kill himself by slitting his wrists. His face and head were bruised up as, when asked how it happened, his response was, I thought if I put a bunch of nitroglycerin tabs in my mouth and hit my head against the wall, they would explode. Another one. Dumb with chronic myopathy since childhood, gets preggers for her 4th time. 2 of the previous 3 kids died of SIDS. Gets so weak from the preg, what turns out to be a complicated pregnancy, she ends up on a ventilator for 3 months. Told she will likely die if she gets knocked up again. Refuses to have her tubes tied. Gets preggers again 2 weeks after getting out of the hospital. Dies. Story 39. Took care of a patient who we had diagnosed with non-Hodgkin's lymphoma. This sweet woman was in her late 20s. For those that don't know, NHL responds pretty well to chemo. Her father-in-law had a business selling camel's milk. She opted for a camel's milk treatment plan over chemotherapy. She was convinced that camel's milk can treat anything. She said she came to the hospital just to find out what it was that she was going to treat with the camel's milk. SMH, she had a 2 and a 4-year-old. Fortunately, I could convince her to only try camel's milk for a finite amount of time and then follow up with our oncologist to see if camel's milk did the trick. Edit typos from speech to text. Story 41 more. I'm telling on behalf of a colleague who doesn't Reddit in the wee hours of the morning. He got called to see a trauma consult. It was a guy who reportedly wandered into the ER, stating head just come from a bus stop across the street from the hospital. He had just woken up there and realized that he was missing his wallet. as well as all of his clothing from the waist down. What you ask would prompt an indecently clothed man to march barefoot across a busy downtown road in a big city by the dawn's early light to seek assistance in the ER. Shame be damned, is really hurt. My friend did an appropriate workup and discovered a large chunk of broken-off concrete lodged in this gentleman's rectum. It required an operation to retrieve it. However, before they whisked him off to the ER, the patient confessed the rest of the story had hooked up with two strange men off of Craigslist, and they'd gone out in one guy's awesome sports car, used copious amounts of illicits and ETOH, and done. Well, at that point, he wasn't too sure just what they'd done. All he remembered was waking up at the bus station with no pants and a rock up his. And then, while my friend was still in the ER with the guy getting consent for the operation, the patient's very worried wife walked in. Story 41, common situation. Do you take any medications? Just aspirin. Okay, great. Later on, do you have any numbness or tingling in your legs? Yes, from the diabetes. You're diabetic? Yeah, but I'm taking meds for that. Okay, sounds good. Any other medications? No, okay. Later on, how much are you exercising? Well, I try to walk a couple times per week because of my blood pressure. Oh, you have high blood pressure too? Yes. Are you medicated? Yes, subconsciously thinking, God damn it. Story 42, had a 70-year-old female come in with a broken rib and clavicle after falling. Tells me her only medications are insulin and Tums. While taking her history, she seems off. She's acting confused. Her voice is deep. Her face is swollen, and she's been having balance problems. Textbook hypothyroidism. Turns out she had her thyroid removed a year ago. When I asked her if she was taking any medications for that, she tells me yes. The Tums, I need the calcium for my thyroid, where she came up with the idea that Tums were a great substitute for your thyroid. I will never know. Needless to say, she left with a new Synthroid RX. Story 43, I'm a nurse practitioner. I did a pelvic exam on a young woman and removed a home-made ceramic satanic doll. She kept it in her vagina. You see, it had the head, horns, and hooves of a goat, the body of what seemed to be the Cookie Monster, and she had tied a felt cloak around its neck. I used forceps to extract this amazing art project and asked her, do you want to keep this? Story 44, I work as a medical assistant in a dermatology clinic, and we had a middle-aged woman come in complaining of vaginal and rectal itchiness. She said she had a boyfriend with whom she regularly had, and attributed that to the itching. So I had her disrobe from the waist down and sit on the exam table for the provider to check. It was obvious that she didn't wash or wipe herself down there like ever. The doctor told her that she only had mild irritation to speak of, and that she needed to regularly wash her privates with mild soap and warm water, to which the patient surprisingly asked, it's safe to do that. Story 45, anesthesia, here self-inflicted gunshot to head, brain dead, organ procurement candidate. Family insist on giving him a brain transplant. They didn't comprehend that they could donate his organ. They truly thought that we could give him a new brain with science and... Story 46, my poor co-fellow at the time had a newly diagnosed Crohn's disease child under his care who is in a gypsy family whose mother won't admit to being illiterate. And as a result, her son's care was being compromised. On the way out of clinic, I overhear the following conversation. Gypsy mom, oh, actually, doctor, I have one more question. Can you prescribe him something to get more girls to be attracted to him? Doc, Gypsy mom, because we've tried all of the Axe body sprays and none of them seem to be working. Doc, you mean like a magic potion? Sorry, can't help you there. Story 47, while in nursing school, I had a patient who had wounds on his leg and refused wound care. Because hospitals are clean and you can't get an infection in a hospital, he refused even after having me. And then my instructor explained to him about hospital-acquired infections and the need for wound care. Story 48, PEDS, patient's parents were given the usual pre-op instructions. Blah, blah, blah. Patient needs to be NPO the usual 8 hours prior to surgery. Clear liquids, only you can see through it. Parents the next morning during admission said they followed the instructions to the letter. They only gave the patient donuts because they could see through it. Story 49, not a doctor, but EMT. I was working in the ER and a homeless guy comes in. Not unusual, he looked completely fine, but he was complaining of unbearable leg pain. My job in the ER basically is to do initial assessment vitals and to get patients settled in. So I go to check out his legs. I cut through his pants and he's wearing knee-high socks. As soon as I cut through the elastic on the socks, maggots, like a waterfall of them. Turns out he was wearing the same socks for 6 months, and they cut into his skin. Good Knees North surgeon said he could save his legs thanks to the maggots. Lesson is change your socks regularly. Story 50, our doc here. I once had 40-something-year-old patient who came in with chest pain. After taking a thorough history, it turns out that it was actually bilateral nipple pain. She was breastfeeding, but wait, it gets better. Turns out she was breastfeeding her 2 kids, who are age 12 and 5. Story 51, not a doctor. I was getting prepped for a hernia surgery and was sharing a room with a young lady in 4. I assume a DC. There was a curtain separating us. Never saw her, but heard everything. Nurse, how old are you? Girl 13. Nurse, how old is your boyfriend? Girl 19. Nurse, have you had a miscarriage before? Girl, yes. Nurse, after the procedure. You'll have to abstain for X number of weeks. Girl, OH. My boyfriend, I'm not gonna like that. Can I have with him up here to tide him over for a little while? Nurse, I got wheeled away before I got to hear the rest. When healthcare providers are confronted with an obvious case of statutory rape, are they required to report it, or does the privacy HIPAA of the patient outweigh the duty to report? Story 52, gastroenterologist here. 2 similar patients, years apart. First one came in with signs and symptoms of cirrhosis. Said he only drank 1 drink per day and insisted on it. And how could he get cirrhosis on 1 drink per day, by the way? Women have been reported to get cirrhosis on as little as 2 drinks per day, but it's pretty unlikely. Anyway, his wife comes in later and tells me he bought a large glass that holds 32 ounces of fluid, and that is his 1 drink. Years later, I diagnosed another man with alcoholic cirrhosis, and he too was incredulous. How could he get cirrhosis? He didn't drink at all. Just beer. How much a case per day? Well, that's not really the stupid part. He drank during the day, on his job. As an electric company lineman, working on hot power lines 30 to 50 feet up, he would drive his truck from one site to the next, drinking beer between each site, and by the end of the day, the case of beer would be finished. Amazing he made it long enough to get cirrhosis. Actually, he was one of the nicest guys you'll ever meet, so it was really too bad. Story 53, attention. Please keep in mind that the OP of this thread has chosen to mark this post with the serious replies only tag. Therefore, any replies that are jokes, puns, off-topic, or otherwise non-contributory will be removed. If you see others posting comments that violate this tag, please report them to the mods. Thanks for your cooperation and enjoy the discussion. I am a Batra Automoderator Minsk 11 Puitis Automoderator, and this action was performed automatically. Please contact the moderators of this subreddit message compose to 2FR2F AskReddit if you have any questions or concerns. Story 54, not a doctor, but work at a pharmacy. Once heard the story of a woman who came and asked the pharmacist what she should ask the doctor to prescribe for a different kind of birth control, as she was having a hard time swallowing the one that she was on. So the pharmacist looks up what she was taking, only to find out that this woman had been swallowing her NuvaRing. Story 55, I had a point with CC of back pain. I casually asked if he ever passed a stone. The replay was no doc, but wait, I did once. I farted and had a stone in my undies. I had trouble to keep my face straight. Story 56, although she wasn't a dumb patient, so much as a stupid, benighted one. Here is the Reddit classic story of the swamps of Dagoba to those who have not encountered it yet. It's not safe for reading. Story 57, once had a patient keep refusing he ever had hip surgery despite multiple CT scans showing hardware in his hip. Sat down and showed him each one spanning multiple years, but he kept refusing he ever had surgery. How do you forget hip surgery? Story 58 happened when I was an intern. Guy came in for some random complaint, got admitted for sepsis, saw him in his room, which had an oddly pleasant odor, kinda odd, but didn't think much of it, started to examine him and saw lots of bandage on his lower leg. Asked him why, and the dude said he had a wound and he wrapped it himself. So I started to take off the bandage and started to see blue. I was like, WTF, more and more blue bandage, and even his skin ulcer was blue. So turns out he thought since he would use Windex and Lysol, etc. to clean tubs and drains, that would also be a great idea on his wound. Took a great while to convince him to stop. Not entirely sure I succeeded. Story 59, this happened in a rural area, and this was at the indigent hospital. A man came in who had been chopping. The axe slipped, hitting his leg. He poured gasoline over it to try to disinfect it and stop the bleeding. Then he lit a cigarette. We were treating him for a very badly infected leg, which was also severely burned. Also, there's a saying in rural areas that it hurt so bad I could have shot it off. A woman came in who had sprained her ankle. She couldn't take the pain, so we ended up treating her for a self-inflicted gunshot wound to the foot. Story 60, I'm not a physician, but I am a healthcare professional. I once had a chest pain patient who came into the nuclear medicine department for a typical MPI, and he had a very pungent, disgusting smell to him. I work out of school at University Medical Center, so we serve the locals and indigent patients mostly. Finally, I get him to acknowledge the smell, and he says his toe has been feeling funny. Turns out he cut it or something, and an infection engulfed that toe and began eating part of his foot. It seriously might have been gangrene. I immediately called our nurse, who notified about 3 different physicians who took samples and immediately rushed him out of our department. Story 61, I worked at a community hospital ER for about 3 years, not an MD. One Thanksgiving, a boy of about 12 comes into the fast-track part of the ER and complaining of abdominal pain. We take him over for an x-ray, and it turns out he had stripped a telephone wire of its plastic coating and fed the copper up his urethra, which subsequently looped around his bladder several times. His bladder was the size of a football. Also, a couple came in with their 1-year-old baby which had ingested some of the mother's Klonopin. The MDs explained that it was eating away her insides and rushed her to a nearby metropolitan hospital. Stupid. Maybe careless, most deaf.